Hi, my name's Taylor, and today we're discussing reference-based pricing and explaining how employers can take advantage of this cost-saving strategy for their employee benefit packages. With the cost of healthcare rising year over year, many employers are exploring ways to improve their bottom line without also having to sacrifice their employees' benefit plans by increasing plan deductibles and other out-of-pocket costs. Eventually, your company could lose its highly engaged employees if continued cuts to these plans are made. Reference-based plans are rescuing many employers from these price increases, and here's how. A portion of your premium is allocated towards paying for access to a physician network, for example, a PPO network or an HMO network. This physician network not only costs more money, but also grants you, as the network member, access to discounted or pre-negotiated prices for procedures. These negotiated rates between healthcare providers and insurance companies are the cause of much frustration for us as patients. Because there isn't a transparent list that is accessible to us as to what a surgery may cost or what can be expected ahead of a planned procedure, likewise, a healthcare provider's reimbursement or negotiated rate isn't necessarily tied to the level of care you might receive. Some healthcare providers may receive 10 times more than other providers for the identical procedure or service. These and other variables cause traditional insurance to have unnecessary layers of middlemen and added costs to monthly premiums. There is one major force that's leveling the playing field and providing competitive standardization to the overall healthcare industry, and that's Medicare. Because there are over 10,000 seniors turning age 65 every single day, Medicare has become a massive influence in the insurance space and is leveraging its size to create standardization in order to eliminate waste, fraud, and abuse. Every few years, a competitive bid is offered by Medicare to healthcare providers, and those providers respond by offering their bid for specific pricing and procedures. The outcome to this competitive bid? A specific reimbursement amount for each healthcare service covered by the Medicare program. 97% of physicians accept Medicare assignment, which means that they're willing to accept the negotiated rate that Medicare sets. The reference-based pricing model for employer plans eliminates the need for a provider network, which means there is no guesswork for a member trying to navigate whether their chosen provider is in or out of network. This gives members the freedom to see providers and also shop for them based on the quality of care rather than network status. By eliminating the provider network, reference-based plans also eliminate the hidden, pre-negotiated rates by insurance companies with those providers. Instead, it replaces these reimbursement rates with the transparent pricing model of Medicare. Reference-based plans use Medicare's index of prices as the reference for their own reimbursement to providers. Rather than just paying Medicare rates, the reference-based plans will pay a multiple of these rates, such as 130 or 150% of Medicare standardized pricing. Let's go through an example of how claims are paid to healthcare providers using traditional medical insurance compared to a reference-based plan. When you go in for an echocardiogram or an ECG as an uninsured person, you can expect to pay between $1,000 and $1,500 for this test. With private insurance, the insurance company may pay the provider between $400 and $800 for the same ECG, including their discounts and negotiated rates. This is far less than the cash price. However, Medicare's fee schedule sets the reimbursable amount for an ECG around $200. With a reference-based plan, your plan may pay a multiple of Medicare's fee schedule. For example, 130% of Medicare's reimbursement schedule, which would mean the provider is paid $200 plus 30%, which would be an additional $60, bringing the total reimbursement amount to $260 for an ECG. Reference-based plans are providing some massive savings for consumers and employers. However, from the previous example, you can also assume that some healthcare providers may not be happy with receiving a lower fee than from a traditional plan. It's wise to be aware of possible situations that can cause members of reference-based plans to have a less than desirable experience. Because reference-based plans don't have contracts with healthcare providers, it's possible that a provider may not agree with the amount they were reimbursed for a service provided. This reimbursement dispute will need to be communicated by the member to the plan's member advocacy program. This advocacy program will work with the provider to come up with a swift resolution for any disputed balances being billed to the patient. These are professional organizations that negotiate claims with providers on behalf of the patient or member. However, this may cause some stress to members not knowing where the liability may fall. It's important for employers to form an action plan to communicate with employees on how and when to get appropriate parties involved when this scenario arises. In conclusion, employers have options when it comes to evaluating solutions to lowering their monthly healthcare costs. Plans using reference-based pricing may be the answer to creating more margin for you and your employees' bottom line. Call us today to find out if a reference-based plan is right for your organization.